Hello. From our previous activity, this is just a recap. As we can see, this is the uterus with the uterine walls, uterine cavity, the fallopian tube, the ovaries, the cervix connecting the uterus to the vagina, and in cases of sterilization, the doctor would tie the fallopian tubes around here so the egg cannot pass into the uterus for fertilization. And in cases of cervical smears that are routinely done in GP practice, they take the smear from the transition zone of the cervix right here.
This is a cross-section of a woman, so if this is her bum and this is her stomach, this is the spine, this is the rectum and the anus, where you poo. This is the uterus, the cervix we were just talking about, the vagina, and here is the fallopian tube, and this is the ovary. So if you have your menstruation or your menses and you use tampons, you put your tampon up here into the vagina and it will catch the menstrual fluids coming off the side of the uterus here. This space here is the bladder, and here's the urethra, so here's where you pee. And here's the anterior part of the abdomen or the stomach wall. Across here may also be your hymen, which is a bit of tissue which covers the entry of the vagina. That's what you break if you, for example, do a lot of sports or do a lot of horse riding. And you also break it when you first have sex, as the penis enters here when you have sex.
And as we move on to our next model, this is an embryo around week 2. As you can see, what used to be a blastocyst, which is a big mass of cells, have now formed a bilaminar disc, 2 layers, and an outer layer of cells called the trophoblast. And this layer of cells is responsible for the attachment of the embryo to the maternal uterine wall. And as you can see, this is the uterine wall, and this is what will become the placenta.
After about a month, this is what the developing embryo looks like. As you can see, all this red bit around here is the uterus or the mother. And growing from the uterus towards the developing embryo are these vessels. So these are special types of arteries called spiral arterioles, and they come from the mother and supply the developing embryo with oxygen, glucose, and other nutrients that are needed to develop. As you can see, the developing embryo is a lot bigger because of continual division of cells.
Via mitosis. Okay. As we can see from this one, the embryo now is about 4 weeks old, and this is the yolk sac. This is the embryo here. You can see a spine-looking line. This is going to be the spinal cord, where all your nerves will develop from. And by this point, the heart have now formed as well, so as the upper limbs. And this cavity here is the amniotic cavity, connected to the umbilical cord. And this whole thing right here is all the placenta. And as you can see, the maternal spiral arterioles send blood into this cavity that is blood-filled, and the fetal side, what we call the trophoblasts before, the outer layer of the embryo, forms those projections. They're called the villi, and they're responsible for absorbing the maternal nutrients from this fluid-filled space and brings it all the way back to the embryo via umbilical vein and takes all the waste via umbilical artery. Fun fact, the yolk sac supplies the embryo up to week 3 to 4. Then nutrients are supplied by the placenta and the mother from then on.
This is even a bit further along as the baby is developing. Here's the baby or the developing embryo. As you can see, the baby has lost what looks a bit like a tail, and now the lower limb buds start to develop. So this is the placenta over here, which is about the same size as the baby or even larger than the baby. And the space around here is the amniotic cavity filled with amniotic fluid, which we spoke about before. The amniotic fluid is mostly derived from the mother through diffusion. However, it also comes from the baby through its urine or through its skin or through its respiratory tract. The baby actually swallows amniotic fluid and then urinates it out. So the fluid content in the amniotic fluid changes about every 3 hours. Around the outside is the uterus that you can see filled with lots of vessels, which supplied the placenta with nutrition, which then diffuse across to the baby.
Okay. As we can see here, this is a baby of about 3 months old, and by this point, after 10 weeks, it is now called a fetus instead of an embryo because all the organs have now been formed and it just grows larger and develops furthermore from now on. This is the placenta, as you can see. And all of this is the uterus with a vast amount of vessels. And the placenta now is slightly smaller than the baby because early on in pregnancy, the placenta develops faster, but by this point, the baby is developing a lot faster and is now called a fetus.
So after this time, the genitals develop, which is about at 10 weeks. So from 10 weeks onwards, you can tell if your baby's going to be male or female. And you can tell that if you do an ultrasound. So you can either do an ultrasound through the vagina, coming up here, or you can do it through the abdominal wall, which you've probably seen on television. So this is a fairly large fetus. This is at about 7 months. So you can see the orientation of the fetus has changed. So here the head is up and now the head is down in preparation for labour, which the head usually comes out first. As you can see, the uterus has really got a lot larger because of the size of the fetus. So this is how big the uterus is at 7 months, and here it is much smaller previously. You can see this is the placenta we were talking about and the umbilical cord here. And the head of the fetus is a lot bigger and this is a model very close to delivery. So this is the mother's bum, this is the front of her abdominal wall. And if we compare this to a non-pregnant woman, this is the back and this is the front. Here's the spine. We talked about how this is the rectum and the anus. Here, the rectum and the anus is really squashed, so it's very difficult for a woman to go to the bathroom. And here, the uterus, you can see, is very small. Here, the uterus is very large because it's accommodating the baby. And here, this is actually the bladder, what looks very squashed. There's no space for the urine, whereas here, the bladder is very large, there's lots of space for the urine. So that means that when a woman becomes pregnant, she needs to go to the bathroom quite a lot because there's no space to store the urine before she needs to go. So if we take out the baby, this is the position a baby is in the last month or so before delivery. Here we can see the placenta, which, although very large, it's smaller than the baby. And here's the umbilical cord, which passes over here to enter the baby at the belly button. There's one very large umbilical vein and two umbilical arteries, which travel in the cord. So the umbilical vein goes into the baby from the mother, and it carries oxygenated blood with amino acids and with glucose. The two small umbilical arteries go away from the baby back to the mother and bring the carbon dioxide and the waste products. This umbilical cord is clamped or cut or tied after delivery. And the next video will show you how the baby is born.